Hi everyone! I'm a board-certified diagnostic and interventional radiologist, and I'm here to help you understand your body better. Today we're talking about a topic that's often overlooked: gallbladder issues. Gallstones. Have you heard about them? Do you know someone who's dealing with them? Or perhaps you're wondering if you should be concerned yourself. Well, you're in the right place. Let's dive into this common health issue, bust some myths, and most importantly, show you how to take control of your well-being. First, let's start with the basics. What is the gallbladder? Picture a small pear-shaped organ tucked beneath your liver. This organ is crucial, and here's why. Its job is to store and concentrate bile, a greenish-yellow liquid made by your liver. Bile plays a critical role in digestion, especially when it comes to breaking down fats. Whenever you eat particularly fatty meals, your gallbladder gets into action. It releases the bile that it's been storing into a series of tubes called the biliary system. These tubes carry the bile to the liver and small intestine, where the magic happens. Bile acts like a detergent, breaking down the fats in your food so they can be absorbed properly. Now, what exactly are gallstones? Imagine a concentrated form of the cholesterol that's found in bile. Over time, this cholesterol can solidify into tiny pebbles or bigger stones within your gallbladder or biliary system. And just like stones in a river, these stones can cause blockages, leading to a whole host of uncomfortable symptoms. And let me tell you, the symptoms of gallstone disease can be really unpleasant. When a stone lodges in one of the tubes connected to your gallbladder, it can trigger excruciating pain in your abdomen, especially in the right shoulder area. We call this biliary colic. Imagine the worst pain you've ever experienced. That's how intense these cramps can be. And they don't last for minutes, we're talking hours. And it's not uncommon for these episodes to wake you up in the middle of the night. But that's not all. The obstructed flow of bile can also make you feel nauseous and cause you to puke. Some people experience jaundice, a yellowish tinge to their skin due to a backup of bile. And let's not forget about fever. When bacteria in the bile duct get trapped, it can lead to a life-threatening condition called cholangitis. Gallstones are the most common digestive disorder in the US, affecting over 25 million people. And guess what? Women are more affected than men, and the numbers are staggering. Over 700,000 women will experience symptoms of gallstone disease this year compared to only 300,000 men. The reasons behind this gender gap are still being investigated. However, several theories have emerged. One points to pregnancy and hormone therapy as a potential cause. The dramatic hormonal shifts during pregnancy and menopause could increase the risk of stone formation in women. Another theory attributes it to the Y chromosome. Yes, you heard that right. Research suggests that the genes on the Y chromosome might play a role in the higher incidence of gallstone disease in men. Lastly, a theory attributes it to body mass index. On average, women tend to have a higher BMI than men, and obesity is known to elevate the risk of gallstone disease. Gallstones can silently form in your body without giving you any hints for years. Many people live with stones without ever experiencing any symptoms. But when those stones decide to move and get stuck, oh boy, that's when you know about it. The pain, the cramping, the nausea, it's no fun. Now let's talk about the silent killer aspect of gallstone disease. You see, while the acute symptoms of gallstone disease can be pretty obvious, there's another silent threat lurking: cholesterol. Cholesterol plays a significant role in gallstone disease. Here's the lowdown. Stones are primarily made up of cholesterol, and when they cause an obstruction in your biliary system, it can lead to a backup of substances like bilirubin. Bilirubin is a brown-colored substance that's produced when your liver breaks down old red blood cells. Now, normally, bilirubin is carried by the blood to your small intestine, where it's eliminated from the body. But when it backs up due to an obstruction caused by a gallstone, it can spill into your bloodstream, causing what we call hyperbilirubinemia. This condition can turn your skin and the whites of your eyes slightly yellow, a sign of jaundice. Additionally, high levels of bilirubin can lead to something more serious: kernicterus. This happens when bilirubin deposits build up in the brain tissue. For adults, this is rare, but it can be dangerous, leading to brain damage. Let's explore the key tests and procedures used to diagnose gallstone disease. Imaging techniques are essential in detecting gallstones and assessing their impact on your health. The workhorse of gallstone diagnosis is ultrasound. It's non-invasive, painless, and provides a direct view of the gallbladder and biliary system. During an ultrasound, we look for stones of various sizes, ranging from the tiny ones that are hard to see to larger ones that are more apparent. Sometimes contrast dyes are used to enhance the visibility of the biliary system. When ultrasound isn't definitive or in cases of complex presentations, we turn to other modalities like computed tomography, CT scans, and magnetic resonance imaging (MRI). These scans offer detailed cross-sectional images of the biliary system, helping us evaluate the extent of the blockage and associated complications. And if there's suspicion of a complication involving the pancreas, we may opt for an endoscopic ultrasound. This specialized test not only looks at the biliary system, but also examines the pancreas, providing invaluable insights into potential involvement of these organs. Endoscopy is a procedure used to visually examine the inside of the body, specifically the esophagus, stomach, and duodenum. To perform an esophagogram, a thin, flexible tube with a camera attached to one end is inserted through the mouth and down the esophagus. This allows us to observe the lining of the esophagus, stomach, and duodenum to identify any abnormalities, ulcers, inflammation, or signs of bleeding. During the procedure, the gastroenterologist may inject a contrast dye to help highlight the structures and any potential abnormalities. Endoscopic retrograde cholangiopancreatography, or ERCP, is a specialized endoscopic procedure used to diagnose and treat conditions involving the bile ducts and pancreatic duct. During ERCP, a flexible endoscope is inserted through the mouth and guided into the duodenum. Once there, a contrast dye is injected to visualize the bile ducts and pancreatic duct. This allows us to identify and diagnose conditions such as inflammation, narrowing, or blockages caused by gallstones or other issues. ERCP can also be used to treat conditions found during the examination. For example, if gallstones are identified as the cause of the blockage, the doctor can remove them during the same procedure. When it comes to treating gallstone disease, we have several options. Initially, our goal is to dissolve the stones if they're small enough and not causing symptoms. This involves prescribing medications that help modify the composition of your bile, making it less likely to form stones. However, if the stones are too big, won't dissolve, or are causing bothersome symptoms, we proceed with surgical intervention. The most common approach is laparoscopic cholecystectomy, which is a minimally invasive surgery to remove the gallbladder. By removing the gallbladder, the source of the problem is eliminated, preventing further complications. If you're worried about gallstone disease, remember to stay proactive. Be aware of the symptoms and risk factors. Work closely with your doctor to manage your health and make positive lifestyle changes, like eating a balanced diet and getting regular exercise. Taking these steps will empower you to keep your body running smoothly. Thanks for joining me today. I'm a board-certified diagnostic and interventional radiologist. I'm here to help you understand your body better. If you found this video helpful, please give it a thumbs up. Sharing is caring. So don't hesitate to share this video with your friends and family. Until next time, stay curious, stay healthy, and remember, your body is worth understanding. See you soon.